Welcome, Professor Vrints, to this small session. You're the chair of the Working Group of Acute Cardiac Care, and I'm Peter Clemmensen, which is part of the nucleus, and I'm here with one of our heads of education, Susanna Price, and we're going to ask you a few questions about the latest developments of acute cardiac care and what this working group really represents within the ESC family. So, Susanna, why don't you go ahead and ask Christian the first question?
Okay, Christian, my first question to you really relates to education and acute cardiac care. How do you see that the nucleus and the working group of acute cardiac care is going to change and develop education of cardiologists of the future across Europe?
Yes, acute cardiac care is a major part of the clinical practice of every cardiologist. And most of the working groups and the associations of the ESC, they are focusing either on a diagnostic technique or a therapeutic intervention. And I think that there is need for integration. And I think that our working group on acute cardiac care can provide a forum for integration where all the new advances in diagnosis and treatment can be discussed and developed into a strategy that can be applied in clinical practice. And I think that our working group has a major task there to educate the cardiologist in acute cardiac care. And it really maybe cardiology has become too technical during the last decades. There is need for a more clinical approach and this more focus on acute cardiac care and integration of new techniques, diagnostic techniques and interventional techniques can help to improve the cardiac care and also the outcome of the patients with acute cardiovascular diseases.
Okay, and I understand obviously that the nucleus has a new textbook of acute cardiac care. If somebody were to buy that textbook or be reading that textbook, what would they expect to find as the real highlights of this textbook? So what's new and exciting within the textbook?
Yeah, the textbook covers the entire spectrum of acute cardiovascular disease and is a major achievement because it provides this state-of-the-art of the current diagnostics and treatments available. But this story is not an ending story. The working group is also working on an e-learning program that will allow us to make further progress and further acquisition of knowledge. And also we are planning this to organize a certification of training centers so that fellows in training can go to a training center that is certified in acute cardiac care where they can learn all the techniques that also are used during the practice of acute cardiac care.
Okay, thank you. Peter?
Yes, all this has been translated recently into a new mission statement. Tell us a bit, what is the new mission statement for acute cardiac care?
Yeah, I would like, my son is an historian and we also always have to look at the history. And originally, the working group on acute cardiac care was created about 10 years ago. And the major aim of the working group was to define and to defend what is the position of the cardiologist in acute cardiac care, especially in the intensive cardiac care unit. But the experience that we had the last decade with the new management of STEMI, I've learned that the role of the cardiologist goes beyond the boundaries of the ICCU, and that we have to look at the whole time span of this acute cardiovascular disease, and that we also have to take care of to be involved in the organization of the pre-hospital phase, that we have to look to the admission of the at the emergency department, the transfer to the cath lab in the ICCU, and afterwards also dus the post-ICCU hospitalization. And moreover, dus the management of acute cardiovascular disease is also becoming more multidisciplinary, more disciplines are involved, and because of this, all these changes, we felt there's the need to redefine the mission statement of our working group. And the mission statement is dus that we should improve the quality of care in order to improve the outcome of patients with acute cardiovascular disease. And we would like not only to involve cardiologists, but all healthcare professionals that are involved in acute cardiac care, dus cardiologists, emergency physicians, intensivists, nurses, and paramedics. And all this in order to improve the quality of care of acute cardiovascular diseases, and also to improve the outcome of the patients. But that really matters, not only during the acute phase, but the better the care we deliver during the acute phase, also the better the outcome long term.
I think this is really important. So what you're saying also is that this is really a multidisciplinary working group, yes, which I also think is reflected in your textbook, where there are contributions from a wider range of health professionals taking care of acute cardiac patients. And how does this also translate into the program in your congresses? Tell us a little bit about the congress that so far has been every other year, but is now moving to an annual event with the recent vote by the ESC board, which is very fortunate. Tell us a little bit about the Congress of the ACC.
Indeed, the ESC board recently has decided that instead of a Congress on acute cardiac care every 2 years, that we will have a Congress every year. The Congress is maybe a short while after the ESC Congress, but it is a kind of a mini ESC Congress, and I think dus that our Congress provides a forum for digestion of the new advances that have been communicated at the ESC Congress, and there is also, we are planning to have much more practical sessions where actual patient cases can be discussed, and so that we can look how we can better apply the new guidelines that have been communicated at the ESC Congress. And also at our Congress there will be also practical sessions, how-to sessions, to educate people in this new techniques in acute cardiac care.
As already mentioned, acute cardiac care is now the largest working group in terms of membership, and of course congratulations for that. But what are the future plans of this working group, given its current size, and also the fact that it has its own journal, a subject that we have not talked about before? But tell us a couple of things about the future plans of the working group.
Yeah, we are indeed very happy that numbers of members is steadily growing, and this proves that we are very successful in the concept about a working group. And for the very next future, we plan, in order to improve the strength of the collaboration between the different countries in the European, on the European continent, we plan a first summit on cardiovascular diseases in mid-October, and delegations from all national societies have been invited to come to the European Heart House and to discuss how we can improve the acute cardiac care, how we can improve the activities of our working group. And I would like to take the occasion of this meeting to urge all the national societies who have not yet sent in the names of their delegates to to send in urgently their delegates so that they can come to this very important meeting for our working group. There's also, because of the increasing this number of members, the increasing activities on this, and also of the importance of the field, we have the feeling that we maybe could become an association of the ESC, and this during the meeting of the constituent bodies that we had last evening, I had the impression that the ESC board was very favorable that we should become an association of on acute cardiovascular disease. So
just touching that on that, Christian, what would you say? Some people would argue that acute cardiac care, every cardiologist should be able to manage a patient who's acutely unwell with cardiovascular disease, and that acute cardiac care is already covered by all the subspecialties and the core cardiology curriculum. What would you say to educate people to understand why it is that acute cardiac care requires specific skills and knowledge over and above and different to those of some of the other subspecialties?
Yeah, if you look at the basic training in cardiology, just to become a general cardiologist, it involves indeed the management of acute cardiovascular diseases, but a lot of the training is also focusing on this diagnostic techniques, echocardiography, dus an invasive and sometimes even interventional procedures like implantation of a pacemaker. And but if you want to become this a very well-trained cardiologist as a major clinical task, this acute cardiac care, you need an additional training of 1 to 2 years to learn all the specific techniques of intensive cardiac care medicine. And also this, you need a lot of clinical practice in the integration of all the information that you get from the history and the clinical investigations that are used in acute in patients with acute cardiovascular diseases. And
if you were speaking to people who were thinking maybe of joining the working group, in joining the working group, would they be able to find some help and guidance as to where across Europe would be places that were excellent in terms of teaching and training and learning the specific skills and attributes that make an excellent acute cardiac care cardiologist? Would they be able to get that information through the working group?
Yeah, we are working on the accreditation of training centers, and we will make also a list available to people who want to become fellow in training in acute cardiac care of the certified centers, top-notch centers where they can learn in optimal circumstances, all the techniques and all the tricks and of acute cardiac care.
And similarly, if you were working as a cardiologist running a cardiac care unit in a centre of excellence, would you be able to put yourself forward as a potential training centre within the working group of acute cardiac care? Is that possible for centres who are already practising excellent acute cardiac care?
Of course, they just have, they can apply for as a training centre. The invitation is open to all centres who want to be training centres. They can obtain certification in the near future, and they will be mentioned on the website and of our working group.
I think it's important also to mention that the working group already has a track record of sharing these experiences of interchange for educational purposes. I think that's important for future members to understand. I was thinking, also looking ahead for next year, tell us a little bit about the next Congress. Where is it going to be, and how many participants do you anticipate will come, and what would be sort of the highlights in terms of scientific content?
Yeah, the next Congress will be in Istanbul in Turkey. That's a very attractive place, but we also have a very attractive scientific program, and we will give an overview, this overview of all aspects of acute cardiac care, and almost 1/4 of the sessions will be practical case sessions, where these cases will be discussed, and thus with reference to the guidelines and to the advances that. Yeah.
Thank you.